Hi, Erin. It's wonderful to meet you today. I'm so glad you could join us, and I appreciate you making the time.
Oh, sure. It's an honor to be here, and I appreciate you being willing to talk about these important issues.
Absolutely. Absolutely. This is such an important issue. And one of the things that really inspired me was hearing Erin Friday's story. And I just love how she talks about bringing everyone together, regardless of their backgrounds, whether they're conservative or religious or liberal. It doesn't matter. She's like, we should all be on the same page when it comes to protecting our children and their mental health and their physical health. And so, anyone that wants to partner alongside that idea, I am ready to hear their story and dive in together. So, what brought you to this issue, or what made it important for you?
Yeah, well, it's interesting. As Erin Friday talked about, there's all different people who are concerned about this issue, and I think most everybody would be concerned about it if they really understood the nuance to what was going on. I think most people just really don't understand what's happening to children. I think that most people, if they understood the harms that are happening, that they would not be supporting this agenda. Unfortunately, there are a few activists, I think, that are pushing a narrative that elicits a lot of sympathy from people, and they really don't understand the underlying issues and how much children are being harmed, how much women are being harmed, how much our whole society is being harmed. And so I actually used to be a strong supporter of the local LGBT community and donated to the local LGBT group because I had a lot of sympathy for their plight and for the fact that there was so much struggle in their community. And I got a letter from them, and they were starting a fundraiser to stop conversion therapy. And initially, when I read the letter, it sounded like they wanted to stop some really very torturous procedures that had historically been done on gay people, which is electrocution or making them sit in cold water, or giving them ipecac when they watch gay porn, to try and turn them straight. But as I started reading more detail, I realized that they were actually trying to stop the therapy that helped me when I was a child and struggling with gender dysphoria. So as a little girl, I had what now is considered a transgender identity. And thankfully, my teachers and my school therapists and other therapists along the way were able to help me to get to the root of the problem and to recognize that I wasn't born in the wrong body. I wasn't inherently flawed, that actually I had some trauma that caused me to reject myself as a girl. And that kind of therapy is now banned in many states because of activists who are suggesting that it's the same, that talk therapy is the same as these very cruel therapies that were used to try and turn gay people straight. So that's how I originally got involved in this. And I didn't even at the time know about the horrible medical interventions that were being done on children. And when I found out that if I had been a child today, rather than getting therapy, I likely would have been put on puberty blockers and then cross-sex hormones and then had my breast cut off and then had a phalloplasty, had a fake penis attached to my crotch. That's what my trajectory would be if I were a child now. So that's why I'm so passionate about it, because if I'd been put on that path, I never would have had children. I would have lost my sexual function and had all kinds of other medical complications as a result of those interventions. And these children, so many of them just have trauma, they have confusion. They really just need support working through the difficult feelings that they're having, not to be encouraged to essentially kill who they are and become somebody else.
Yeah, absolutely. The things that you mentioned are so horrific. And I have friends, very dear friends, who are members of the LGBTQ community, and I would never, ever advocate for any of those by any means. But I think that you mentioned something that's so important, is that when you're an adult and you can make your own decisions. I personally believe that if you can join the army and you can vote and you can adopt a child and you can get married and you can buy alcohol and cigarettes, then you have freedom, right? So I'm not going to stop your freedom at that point. But if you're underage, I'm still not going to stop your freedom necessarily. But I do disagree with permanent things happening to our children, right? So cutting a breast off, you can't grow another one back, right? So if that's something that wants to happen after 18, it's my personal opinion, that's fine. But under 18, we don't recognize them as having the cognitive ability to vote. So why allow them to alter their bodies permanently? So that's my position, but I understand there are others.
Yeah, and I actually have a little bit more nuanced of a position, because these medical interventions are being done on people who essentially have mental health issues. I do think that our ability to consent is compromised when we're struggling with serious mental health issues. In the same way that there are people who want to commit suicide, and we don't enable that because we recognize that suicide is harmful. We have anorexics who probably would jump at the opportunity to have liposuction, but that would be very dangerous for them, or a gastric bypass. And that's how I feel about even adults who struggle with gender dysphoria, that allowing them to pursue these very dangerous medical interventions rather than getting the kind of therapy that can help them resolve those feelings is really medical abuse. And the other thing is that societally, there are impacts when adults are actually putting forth the idea that they can alter reality, that they can become something that they're not. That impacts all of us. So I respect freedom, and I understand what you're saying as far as live and let live. Adults should be able to choose for themselves. But when their actions have impacts on others, then those freedoms do get constrained because they start impinging on other people's freedoms. And we see that with adult males who are suggesting that they're actually women and competing in women's sports and taking away championships from women, or going into women's restrooms. And a lot of times these are fully intact males, their male's genitalia, and they're getting sexually aroused by pretending to be women. And so I think that I have a little bit more nuance than you do as far as what adults do, because their behaviors do impact others. And again, somebody who's really struggling with gender dysphoria, that's someone who has a mental health issue. And if doctors enable them to essentially self-harm, then I think that's a huge disservice. And I've talked to a lot of detransitioners who really wish that they had therapists who had challenged their gender dysphoria and not affirmed that misbelief. These are people who now are just terribly damaged by the medical interventions that they got in hopes that it would help them feel better, when in fact it ended up just causing tremendous damage to their bodies. And one of the things that helped me accept myself as a woman the most was when I had my daughter. And up until that point, I still really struggled. I still had a lot of self-hatred. I still was very uncomfortable being a woman. But when I had my daughter and I looked at her and she was so beautiful, and I thought, my body did this. It's actually a pretty cool body. And just that acceptance that I developed after having my daughter, I just think I would have been denied that if I'd been put on puberty blockers. I never would have had the opportunity to be a mother. And that has been so healing for me. And I know not everybody is going to want to have kids, but there's going to be a moment in everybody's life when they finally accept who they are. And I feel like sometimes people need therapy for that. Sometimes they need supportive community. Sometimes they just need someone speaking truth into them and letting them know that it's very normal to have feelings of discomfort. And especially when going through puberty. And Erin Friday's story is so typical. She's a mother whose daughter developed gender dysphoria as a teen. And that's so common these days because children are being told if they're uncomfortable with their puberty, that it's because they're born in the wrong body and that they should just become the opposite sex. Basically, kill who you are, become somebody else. And that's a really dangerous message to give to kids. Rather than teaching them to be resilient and strong and overcome difficulties, we're encouraging them to basically assume a new identity if they're struggling with any problems. And then one of the things that I'm seeing among kids who develop gender dysphoria is that they're developing multiple personalities. So they'll develop a transgender identity. Maybe they'll be non-binary. And then that doesn't work. And so then they become transgender. And then that doesn't work. So they become genderqueer. And they just keep trying on new identities because they are not learning how to deal with the problems that they're having. They're being taught to recreate themselves every time they're having struggles, rather than learn how to deal with those problems head on.
Well, I think you touch on a really good point there, because we should always encourage children to try new things, right? So that's why they're in soccer one year, and then they might go into dance, and then they might go into another hobby or another sport. And so being able to constantly try out new things as part of childhood. And so one of the things that very much disturbs me about uh, making these permanent changes, like putting little girls on testosterone so their voice will never go back to normal. Well, there's kind of a myth that you can, but I've had friends and they were on testosterone as a child, and they can never sing the way they did before, and that led several of them to dark places. So it's making permanent changes. Children are always changing in every other field of their life and exploring. So it just seems discongruent to me that we would accept off the bat, like as soon as a child says, "Oh, I think I'm trans," that it's going to be this permanent decision and it's okay to start removing body parts, instead of sitting with the child, like you said, and having those dialogues and that conversation and that discussion. I don't believe it should be something that's punished in any way or something that is mistreated or cruelly treated. But on the other hand, what happened to having candid conversations like we would about anything else, especially therapists? Like, that's what they're for, right?
And it's interesting because what you mentioned, these permanent changes, and I think that that's really something that people don't understand, because all the time activists say these are reversible interventions. And it's true that a child can stop taking them at any point, but it's not true that the changes that have been made are reversible. So as you mentioned, the voice, if girls take testosterone, their voice drops, and that's a permanent change. If they're on puberty blockers and cross-sex hormones for long enough, their fertility is compromised for life. I've talked to males who've been on puberty blockers, and their male genitalia shrinks to that of a toddler, and it doesn't grow back. These are permanent changes. And so, as you mentioned, childhood is a time where we try different things, see what works, see what doesn't work. And in no other case do we like solidify a decision of a child. So like my son, when he was 3 years old, wanted to be a truck driver. I didn't say, "Yep, you are a truck driver. That's what you are. That's who you are. You will be a truck driver for the rest of your life. We're going to get you in driving school. We're going to make sure we save up so you can have a semi truck." We don't do that with children. We let them explore these, how do they want to be when they grow up? But in this one case, we say, okay, this is a child who now needs to be medically altered, permanently changed because of feelings that they're having. And again, these are feelings that they're having, and oftentimes linked to trauma. So when I started speaking out about this, I had people reaching out and saying, "My story is so similar to yours. I was raped. I had a sexual assault. I was being sexually abused by a family member. And I had such hatred for being female because of that I wanted to become something else." And unfortunately, they live in a time where they didn't get the help that I got. Instead, they were pushed to medically transition. And now, in addition to the trauma that they had that never got addressed, they also have the trauma of being essentially medically abused. These are children whose bodies have been medically abused. I would almost say sexually abused by the medical profession, because they have been encouraged to believe that who they are as male or female is not okay, and that they have to make these permanent changes in order to even survive themselves. And I can't think of anything more damaging to tell a child, that the only way they can survive being themselves is to become somebody else. This is not a message we should give to children. We need to equip them with skills so that they can be resilient, so that they can work through difficult things that happen in their lives and come out stronger in the end.
So, shifting a little here, how do you think practically that would play out? So you have a child, maybe there's a parent and they have a child or a teacher. I worked in education for over a decade now, and they come to you and they say, "Hey, I'm experiencing these feelings." Take me from that moment when they come to you. What's the response in a way that is both supportive, where you're showing that you love and care for this child and they are not in any way in trouble, they are not being punished, it is okay, but on the other hand, not going to that other extreme of like, okay, let's get you to the doctor immediately and you're going to start transitioning today. Where is that balance? How does that play out in real life?
Well, I think the first thing that we need to do is validate those feelings. Acknowledge to the child that we understand that they're feeling this difficulty, that they're feeling this confusion, they're feeling this discomfort and even self-hatred with themselves. To really hear that and to honor that, to recognize, yes, these are legitimate feelings. You really do have these struggles. I'm not going to dismiss it and say that those feelings are just wrong. I'm going to say, I understand that you're having those feelings. And then I would probably ask a lot of questions. Why is it that they're feeling that they're born in the wrong body? What is it that makes them feel like they're transgender? Sort of to really eke out what exactly is it that they've internalized. A lot of times, these are girls who are just gender nonconforming. These are girls who would have been considered tomboys 30 years ago. These are girls who don't want to adhere to regressive sex-based stereotypes. And we celebrated them 20 years ago. We said, hooray, you don't have to adhere to these regressive stereotypes. It's okay if you're a girl and you want to wear boots and you want to play in the mud and you want to go hunting and you want to, do things that are non-traditional roles for women. We would celebrate that. Now these girls are getting the message that if they're gender non-conforming, it's because they are transgender. And again, that's just such a difficult message. So I would help them maybe try to find them role models. My school psychologist did some really simple things, very simple things. First of all, she encouraged my mom and my teacher to find strong female role models for me because I was feeling very vulnerable being a girl. I thought I was going to be re-victimized if I was a girl. So they tried to find me role models of women who were strong. And one of the things that my stepdad did that I know not everybody would agree with, but he took me to the hunting range and taught me how to fire a rifle. And there was something about that was very empowering for me. Like, I can do something that is non-traditional for being a girl, and it's okay. And I'm still a girl. So finding those non-traditional female role models for girls, I think is really important to show them you can be a girl, but you don't have to be the typical girl. You can be, I love Temple Grandin. I don't know if your viewers or your listeners will be familiar with her. She's a woman who has autism. And if she were a child today, I have no doubt that she would be encouraged to believe that she was born in the wrong body. And if she had been, she might not be the most amazing researcher and advocate for humane farming and humane slaughtering of animals that she is. Because she was able to sort of be embraced as gender nonconforming, she's just an amazing woman. If she had been a child today, I have no doubt she would have been told that she was transgender because she did not adhere to the traditional ways of being a girl. She was very unusual, very creative, very different in how she approached life in a beautiful way. And so many of the girls who are coming out and saying they're transgender are on the autism spectrum. And that's because they don't fit in. They're not as social as the other girls. So I think really talking to these kids, not dismissing them, but talking to them and showing them alternatives. The other thing that my school psychologist had my parents do was to get me involved in activities like brownies and Girl Scouts so that I was around other girls because I really did not like being around other girls. And initially, I really chafed against it. I did not like it. I didn't want to be around other girls. I wanted to be on the soccer field with the boys. I wanted to be, out rough and tumbling with the boys. I would have been really happy if they had signed me up for Boy Scouts instead of Girl Scouts. But I'm glad that they had me be a girl. In retrospect, it was really good for me because it helped me to socialize. It helped me to learn to socialize better because I really struggled with my social skills. Another thing that they did was put me in a communication class because I had a hard time using my words, as they say now. I was aggressive. I would kick and I would bite and I would yell and just had that physical anger. And part of that was because I was like, I'm a boy. I'm going to act like a boy. But part of it was just because I had so many confused feelings and I didn't know how to express them. And so getting in a communication group where I learned how to verbalize my feelings really helped, and gave me a lifelong skill that now I'm much better at talking through my feelings than I would have been if I hadn't had that. So there's some really simple things that parents can do if their children are struggling with these issues. And I think, let your kid be, if you have a daughter who wants to be gender nonconforming, allow that child to have that creativity. Allow that child to explore how they want to dress, how they want to interact with the environment, while giving them a clear message that the way they look on the outside does not change who they are. They're still the same person, whether they're wearing, khakis and boots and a business suit, or whether they're wearing a dress. Like, they can't change their basic biology just by simply presenting differently.
I loved what you said about taking you to the hunting range and embracing who the child is. Like, who are they and what are their interests, and just letting them do that. One of my favorite books that really influenced me growing up, my parents got this little book of classics, and one of the stories was called William's Doll, and it was about this boy that wanted to have a doll, and he wanted to be a dad when he grew up, and he was made fun of for it and bullied for it and whatever. But at the end of the day, he gets the doll, and he gets to be a dad, and that's his dream, and it kind of ends in a very cute way. And so they use that to be like, hey, you can be whatever you want to be. You can do whatever you want to do. And being in your body, it's not like, that's just a part of who you are, but it's not going to stop you. And I love that you gave that as an example. And also the communication skills, because regardless of whether, say the child does turn 18 and they say, hey, I really do still feel like I'm trans, I want to go through with the surgery. Anyone can use communication skills, and having those skills to talk through trauma, which statistics show so many of trans children and trans adults have been through more trauma than a lot of the rest of the community. And so having those communication skills to talk through that trauma just seems so vital in general and in life. So I'm so glad you brought that up.
And I think people don't realize how damaging these interventions are. And I thought it was really interesting the other day. I was talking to a dog breeder, and there's a new movement within dog breeding to put off sterilizing dogs until they're older, because they're finding out that when you spay or neuter a dog when they're young, that dog is not as healthy, that their bone density isn't as good, that they're not as healthy as they would be if they had been allowed to mature into full adulthood before getting spayed or neutered. And I thought that was so interesting, that we're recognizing that our animals need to go through puberty. That's something really important. Lots of things happen during puberty. And if you block that, you're not just blocking those secondary sex characteristics that people think of associated with male or female. So facial hair for men and breasts for women. You're not just blocking that development. You're blocking a whole slew of other physiological development that has to do. It helps with brain development. It helps with emotional development. All sorts of things happen during puberty. And when you block that, you're denying that child the opportunity to fully develop and realize who they're going to be. You're basically inducing retardation. And I don't think that there's any other case where we encourage parents and where doctors would encourage retarding the growth and development of children. And these are kids who are never going to have the experience of going through puberty with their peers. So even if at some point they go off the puberty blockers, and if their puberty resumes, which we don't know if it does, a lot of that is case specific. It depends on when the child started puberty blockers, what the dosage was, whether they were on cross-sex hormones. But in the ideal circumstance, if a child goes off puberty blockers and their puberty does resume and they go through puberty, they didn't do it with their peers. And so even that is going to have a huge impact in that we know that one of the benefits of going through puberty with your peers is having that social interaction and having that experience with your peers. But the other thing is that that's the best case circumstance. And I've never heard of a child who was on puberty blockers who went off them and their puberty just resumed normally. In every case that I've ever talked to somebody, there have been long-term consequences for going on the puberty blockers. So these are my understanding is that puberty blockers were once used to chemically castrate sex offenders, and that in many cases they determined that that was cruel and unusual punishment because the consequences of the puberty blockers are so profound that they felt like it was inhumane to give puberty blockers to sex offenders. And I recently talked to a woman who worked with juvenile sex offenders, and she said they would never use puberty blockers to try and control the sexual urges of these juvenile sex offenders because the puberty blockers have such profound negative impacts. And here we are giving them to children who are confused and who just need some time and some help accepting who they are. And I really like to use the analogy of we're essentially telling them to kill who they are and to become somebody else because of some discomfort that they're having. We're encouraging self-harming behavior rather than helping them to find comfort, and that sets up a whole string of confusing thoughts to them, so that they don't learn that they can function. They believe that they are unable to function without these medical interventions. And they're encouraged to believe that. We've actually got situations where therapists have told kids to threaten suicide in order to get the medical intervention. And that's part of the narrative that we hear, is that these kids are going to kill themselves if they don't get these medical interventions. And that is an incredibly dangerous narrative, because we know that suicide can be a social contagion. If we tell kids that the only way that they can survive is to get these medical interventions, and then they're not able to get them, then we've set them up to be suicidal. And we're seeing that these kids oftentimes, once they go through all these medical interventions and they find that they still have the same problems, they're still struggling, they still have depression, anxiety, they're still not fitting in very well, that's when we see the suicide rates go up. And it's because we've told them that these are going to cure them, and they don't. These interventions don't cure them. They, in fact, cause more problems because they result in damaging an otherwise healthy body.
Yeah, and I think that is one of the reasons that the trend is shifting and more people are uniting around this issue, because if it really was the cure-all, we should see the suicide rates drop tremendously. And that is what parents have been told. That is what educators have been told and counselors have been told, that if you don't go ahead and support and get the sex change surgery, like, the kid is going to kill themselves. I mean, I hate to say that, but that's the reality. Or unalive themselves, I think, is the more proper term. But unfortunately, if you look at the stats, they're so close. Like, the statistics are so similar that it should be yelling that we're doing something wrong for stats to be that high.
Well, and actually, with suicide rates, if you look at the suicide rates among children, they have gone up tremendously at the same time that we've become more accepting of the transgender ideology. And so there's clear evidence that actually these interventions are not helping. If you look at the number of suicides among especially the age group of young teen to mid-teen girls, those suicide rates have gone up tremendously in the past 10 years. And if these interventions were helping, that's not what we would see. We would see a decline in the suicide rates. So it's very clear that these interventions are not helping. It's very clear that these interventions, and there's a good study in Sweden where, because Sweden has socialized medicine, they track each and every patient. And they've shown that those patients who go through the full medical transition actually have a significantly higher suicide rate, 19.5%. That's a profoundly higher suicide rate. And so one of the things people don't recognize is that in the short term, often these medical interventions do help kids feel better. Most girls, if they started taking testosterone, would feel really good initially. So you and I, if we got on testosterone, initially we'd feel great because it's a controlled substance, it's a steroid. It would give us confidence. It would make us feel stronger. We'd have an increased libido. all of these things would help us to feel really good. So we'd think, oh, we found the right cure. This is a cure. We're feeling good. And your friends might look and say, wow, she looks great. I think I'm going to try some of that testosterone. I think I might be trans. And they get on it and they feel great. And so there's this sort of self-fulfilling, because of the way testosterone works, it makes kids initially feel like they found the solution, they found the cure. Unfortunately, it's a short-term cure. And we find that once somebody's been on testosterone for a couple of years, it starts to have horrible, horrible consequences to their bodies. So it's sort of like telling a child, hey, why don't you go ahead and take some heroin? It's going to help you feel a lot better, even though we know in the long term it's going to have horrible consequences. And that's something that I think people don't recognize, is that they have all these examples of, oh, I have a neighbor, daughter was really depressed, she started taking testosterone, she feels so much better. So they think that the testosterone cured the gender dysphoria, when in fact it's just a function of testosterone that girls and women who take testosterone initially feel much better. And so it's sort of, it reinforces the narrative that was the cure, but they're not looking at long term, and they're not looking at 5 years down the road when that child suddenly is having rages, is having, difficulty controlling their sexuality because they're, revved up on steroids. We are very clear that we don't want children doping in order to perform better in sporting events. And essentially what we're doing with giving testosterone to girls is we're doping them. And again, this is not we don't want to encourage children to believe that they should take substances in order to feel better. We can teach them that, yeah, going through puberty is rough, but you're going to make it through. You're going to be okay. And we can teach them lots of skills for how to handle difficult feelings.
Yeah, I love that. We need to be equipped more general for that. And I think overall, my personal belief is that we need to take a serious look at the mental health industry and mental health and how we treat it in America today, because regardless of trans or not trans, our children's mental health rates are horrible. But let's go ahead and shift a little bit back into action. And I just wanted to ask, do you feel like this is a voting issue? Is this a school board issue or a parental involvement issue? How does this translate practically to creating change for our children?
I think all of that. I really think that this is something that we have to address in lots of different ways. I really encourage parents to get involved with their schools, because a lot of this is happening in schools and parents don't have a clue. I can't tell you how many parents I've talked to who have found out that their, oftentimes autistic teenage daughter is going into the boys' locker room and they had no clue that was happening. And they're just devastated. So it's really important that we know what's going on in the schools. So that's an area that I think we have to be more involved in, because teachers and school counselors are hiding things from parents. They're really usurping parental authority, and they're encouraging kids to do things that the parents would not be okay with, and actively hiding it. So schools are an area that we need to get involved in. I think legislatively we need to get involved. I've been to many legislative hearings where they're trying to stop these medical interventions for children. And I hear doctors get up there all the time and say the government should not be involved in healthcare. Well, guess what? The government isn't involved with healthcare, because if the government isn't involved with healthcare, we have things like the opioid crisis that happen. Doctors oftentimes do things that are not good for patients, and we need oversight. It's really important to have oversight. And when a doctor says, get out of my office, I don't need your oversight, it makes me wonder, they're not God. They seem to be thinking that they're God. And that's the kind of doctor that does need oversight. They need someone looking in and making sure that they're doing what's in the patient's best interest. Oftentimes, I think that there are family practitioners who are following, that they're going along with this because they think they've heard that this is what they're supposed to do. They're not very well educated on it. And so I think legislative efforts are important. Having just something to, put a pause on all of this. Give kids a chance to go through puberty, give kids a chance to work out these difficult feelings before they go and medicalize. And the vast majority of the kids, if they're allowed to naturally progress through puberty, will not go forward with medical treatments when they're adults. We have good research showing that gender dysphoria tends to resolve. Puberty is actually one of the cures for gender dysphoria. As a child goes through puberty and becomes an adult, that's what helps to cure them of these confusing feelings. So legislative efforts are really important. I also just think outreach and education, this podcast, talking to your neighbor, sharing resources. The organization that I'm president of, Advocates Protecting Children, we have lots and lots of resources. There's a book called Parenting in a Transgender World, specifically for parents, to help them equip their kids with truth so that when the kids are out there in the world, they're not as influenced by this ideology. We have a book out there called Detox, Detrans, Desist, which is specifically for parents whose children have announced a transgender identity and the parents don't know what to do. So that's a book that can help them to work with their child, to help their child walk through this. And we've had lots of good results. We've had many, many parents contact us and say, my child announced a transgender identity. I did what you suggested. They're doing so much better. They've accepted that they're just a gender nonconforming teenager. And that's such good news. That's a child who's not medicalized for life. I also think that it's just important that we push back on the language that's being used. A lot of times the media presents things in a way that is very disingenuous. So you'll hear things like there's efforts in schools to prevent trans children from participating in athletics. And that's not the case. I don't know of anybody who's trying to prevent a child who's got a transgender identity from participating in sports. There are people who are trying to protect girls from boys participating in sports and boys being in their locker rooms. As a child, as a result of the sexual assault that occurred to me, if I had adult or even teenage boys in the locker room with me at school, that would have been incredibly scary for me. And there are a lot of girls and women who have PTSD as a result of sexual assaults. Those are kids that should not have to put up with adult males, teachers, and teenagers in their locker rooms, in their bathrooms. And so I think pushing back on the language and saying there's no such thing as a transgender child. There are children who have gender confusion. Those are children who need our help. And those are children who can learn to work through those difficult feelings and accept themselves for who they are, be much healthier as a result of that, not be spending millions of dollars over their lifetime on medical interventions that are unnecessary. So just doing outreach and education. I encourage people to go to our website. We have lots of resources there. It's advocatesprotectingchildren.com. And it has lots of resources. It might be .org, I'm not sure. And it has lots of resources on there for people on what they can do to push back on this ideology. Because one of the ways that this ideology has gained a stronghold is that it's encouraged people to believe that it's loving and caring to accept a child who says they're transgender. And I just want to push back on that, say that is not loving and kind. In no way is it loving and kind to encourage a child to believe that they're so flawed that they have to medicalize themselves in order to survive who they are. That is not loving. That is not kind. And so to really just push back on some of the narratives that are being pushed. And I really believe that a lot of this is being pushed by Big Pharma, because if you look at what happened with Big Pharma, puberty blockers used to be used for chemical castration and other things. And then they stopped using it for that, so that they needed to find a use for puberty blockers. Estrogen used to be used to treat female menopausal symptoms. And then they found out it caused breast cancer. And so they needed a new market for that. Testosterone used to be used to virilize men. There was a huge lawsuit that a bunch of men won, because it turns out that even adult men, if they take a lot of testosterone, it causes a lot of damage. So they had these 3 products that they no longer had a market for. And then with one narrative, they're able to have these products for all 3 of these products now in use. We know that pharmaceutical companies are willing to do things that are damaging. They're willing to hide evidence. They're willing to do things that are really damaging. We have example after example of Big Pharma hiding the results of the damages that medications have done. And the opioid crisis is just a glaring example. But there's lots of other examples. And they're willing to take the risk because they know that even if in the long run they get sued, the amount of money they're going to make is huge compared to the fines that they're going to get if they lose the lawsuits. So they're willing to take the risk, and they're willing to damage our children. They're willing to push this narrative in order to make a profit. And so when I talk to people, a lot of times I really just push back on the idea, like, when did you start trusting big pharma? And can you look at their track record? And can you really tell me that you trust them and that you're willing to put your child in their hands and medicalize your child with something that they say is safe? They said, all kinds of things were safe. These are doctors who are willing to sacrifice children in order to make a profit, and they've historically done it. So that's another way to educate people, is just to have them look at the track record of big pharma and ask, do you really trust these companies with your child's health and well-being?
Yeah, I 100% agree with you. I have a lot of family members in the medical field, and one of the things that you see throughout history is that we learn from our mistakes and we move forward. But unfortunately, every time we learn from our mistakes, there's millions of people that have usually been harmed first. And, there's drugs out there that save lives, and there's drugs out there that are now off the market because they have killed so many people. So I think taking a look at our history is always, always vitally important to tell the complete story. And I believe everyone, regardless of what you believe, whether you agree with me or with Erin or, have a different opinion, look into the history of big pharma, look into the history of medicine, because it tells a very interesting story that casts light on this that's quite relevant and important to have. So, Erin, are there any last remarks that you have for us? I want to be conscious of your time, and I'm just so appreciative you were here for us today. And we will definitely make sure that your site and the books that you mentioned are in the show notes for this so that people can access them. And I encourage everyone to check those out. But is there any last remarks you want to leave us with?
Well, I think one of the things that I do want to leave you with is to have compassion. These are people who are struggling. And I think there's a lot of anger out there on both sides. But as you mentioned at the beginning of the show, we are really advocating for the health and well-being of children. We love these kids. A lot of times these kids are told that anybody who doesn't support them hates them. And we really need to push back on that and say, no, we care about you. That coming at this with compassion, I think, is so important. There's a lot of people who have a lot of hatred. And I understand that there's anger out there, but let's direct the anger not at those who are struggling with gender confusion. Let's direct the anger at the forces that are encouraging that, and not at the children, not at those who are struggling. These are children who really need love and support and compassion. They need to know that we care about them, that we want them to be healthy. We want them to survive. We don't want them. I've seen people who talk about, anybody who doesn't support your transition is a hateful, homophobic, transphobic bigot. And it's so important that we make sure that these kids know that that's not the case, that we want them here. We want them healthy. We want them productive. We want them to feel good about themselves. That's why we're pushing back on this, not because of these other things that are often said about us. And so rather than coming at this with anger, coming at this with love and the realization that we have truth on our side. We have the science on our side. We have the evidence on our side. We don't have to be angry. We don't have to be mean. We can address this with love and compassion.
Yeah, I love that. I love that. We all love our children. I think they are the forefront of what we do. They're definitely important. They're important. They're our future, right? And we want them around, all of them around, regardless of whatever mental struggle or emotional struggle or abuse, assault, mental illness, or feelings of gender dysmorphia. We want them around for the next 80 years. We want to keep all of them alive. So however best it is to do that and to take a stand and make sure that they are allowed to have that beautiful, healthy, wonderful, and fulfilling future they deserve. Thank you so much, Erin, for your time. I'm so glad you were here. And I will definitely be following you and looking to see what you have to say in the future.
Well, thank you so much for covering this. And again, if anybody wants some more information, there are lots of good resources out there. Advocates Protecting Children, GenSpect, First Do No Harm, lots of resources out there. And as you said at the beginning, there are people who are coming at this from lots of different perspectives. It's, we have radical feminists to Christian conservatives coming together on this issue because we want to take care and protect our children.
So I'm very grateful to have had Erin Brewer on today. I think she is a phenomenal person, and I believe that even though we disagree on certain things, that the overall mission of protecting our children is just so important for parents and educators and school board members across the nation. We definitely have a mental health crisis on our hands, and we say this over and over again, but I loved how she gave practical suggestions for how to move forward and make life better for our children. And while as an adult, I think we should be personally, this is my personal opinion, I think as an adult, we should be allowed to make the choices that we want to make. As children, I think we do need to shelter our children in the sense that they should be allowed to express themselves. If they want to be a girl but do boy things and like robotics, so to speak, or science, or whatever is stereotypical male, I think that should be allowed. And the same for boys. I think they should be allowed to explore the creative sides of themselves and other things like that. I don't think we should stereotype either gender, regardless of how you look at it. Some studies I've seen say that the suicide rates go down as, thanks to gender surgery, sex change surgery. I've also seen stats that say otherwise, but regardless, the stats either way are so alarmingly high that they beg the question that we should relook at our approach. And so what I would call viewers to look at is look at those stats with Big Pharma that she talked about. Look at the history of Big Pharma in the past. Look at the statistics for mental health and children. Listen to people from both sides of the aisle, because listening to each other is how we make change and build relationships and bridge these gaps, because ultimately, regardless of how different we may be, at the end of the day, we all should care about our children and their future and the best for them. So I hope that this episode has proved enlightening, and I hope that together we can work for a better future for our children holistically, both in their education as well as mentally and physically, so that they can enter the future and live these full, fulfilling lives that they deserve, each and every one of them, to live.